stay with us. The call to action is coming soon. So Dr. Ely, you've done a lot of work in helping people understand this asymptomatic transmission, right? And in your upcoming paper, I think it's going to be also highlighted. What we'd love to hear from you is a little bit more about that concept, as well as safe and effective treatments that are available, but they're getting almost no mainstream coverage.
Well, Sayer, thank you so much for that. And what I want to say first and foremost is I'm very passionate, and I'm also very optimistic. And I believe that there are good people in these institutions. I believe that there are good people at the county level, at the state level. I've been very fortunate to talk with the head epidemiologist on an expert forum just last week about nutrition, and he agreed with me that nutrition, that people who get the nutrition we're about to talk about have much better outcomes, and that we have to do a better job of getting that information to the people. And so I'm openly pressing to collaborate with him, and our intention is always to collaborate with the good people who don't have an agenda, don't have a financial motive, or a conflict of interest, and so forth. So to that end, I really commend what Dr. Martin is saying, because it's so passionate, what Dr. Jack is saying, because it's so just passionate. And I think what Dr. Jack just said, that as a doctor, it makes me go, this is exactly why we do, Sayer, confirmatory lab testing. We don't rely just on one test as the key and only diagnostic. We rely on viral load testing. We rely on antibody testing. We take a sample, we put it in a live cell culture and see if it can infect the cell and therefore prove infectivity in the person. But in medicine, we don't rely on one test ever. We always have confirmatory tests, and that's what helps us get to what's so important, say, what's called the definitive diagnosis. Now, as it pertains to nutrient deficiencies, the CDC has known via their NHANES studies for over 20 years that 35 to 45% of Americans are deficient in vitamin A, 37 to 46% of Americans are deficient in vitamin C, 65 to 95% of Americans are deficient in vitamin D, 60 to 84% of Americans are deficient in vitamin E, and 11 to 15% of Americans are deficient in zinc. It's not a coincidence that each of these nutrients I just mentioned are key biochemical players in a well-nourished and effective immune system. You need to have these nutrients in order for your immune system to do its job, so that if even one of these is missing, then you run the risk of an immune system that is not able to correctly deal with infections, including SARS-CoV-2. We've culled the research there. My team has just crushed it on this level, finding hundreds of evidence-based clinical trials specifically for COVID. I'm going to read just a couple of them to your viewers. Vitamin A, vitamin C, vitamin D, and iodine were administered to 107 moderate to severe COVID patients. All of them fully recovered within 7 days of treatment. And this was actually published on Dr. Jack's independent peer-reviewed journal, IPAC. A Chinese hospital in the epicenter in Wuhan took on 50 cases of moderate to severe COVID-19 and used IV vitamin C. And what they found was that not only was there no morbidity, but that the stay in the hospital was on average 3 to 5 days shorter than the people who didn't use intravenous vitamin C therapy. There was no mortality in the IVAA group. There were no side effects from the IVAA group, and there was a successful 100% management of cytokine storms. Huge. Vitamin D3 in another study significantly reduced ICU admission rates, as well as reduced the severity of COVID-19 disease. Of the 50 total patients who received vitamin D3, only one was admitted to the ICU. That makes up 2% of their study. Of the 26 patients who were not administered vitamin D3, 13 were admitted to the ICU. Of the 50 patients treated with vitamin D3, 0 deaths occurred, and all 50 patients were eventually discharged without complications. Just a couple more. Vitamin D deficiency was associated with increased hospitalizations and increased mortality. Severe cases of COVID-19 were 64% more likely to be vitamin D deficient than mild cases of COVID-19. Their conclusion, Sayer, vitamin D deficiency is associated with higher infection rates, increased instances of sepsis, and increased mortality risk among critically ill populations. Last one for you, Sayer, on the studies. A total of 191,779 patients were included in this study. Median age was 54 years. 60% of the enrolled participants were female. The SARS-CoV-2 positivity rate was higher in the 39,190 patients with deficient levels of vitamin D, that's under 20 nanograms per milliliter, than the 27,870 patients with adequate, and adequate was just considered 30 to 34 nanograms there. From a naturopathic doctor standpoint, that's still deficient, okay? But when we get to over 50 nanograms per liter of vitamin D when they do a blood sample, only 5.9% of the people who had that high level of vitamin D circulating in their bloodstream even contracted it. Now here's their conclusion, Sarah. SARS-CoV-2 positivity is strongly and inversely associated with circulating vitamin D in the bloodstream, a relationship that persists across all latitudes, all races, all ethnicities, both sexes and age ranges. What did I say earlier? This is SARS-CoV-2 doesn't care what the color of your skin is. It cares about your nutrient status. All right? Their final statement on this, our findings provide impetus to explore the role of vitamin D supplementation in reducing the risk of SARS-CoV-2 infection and COVID-19 disease. Now, what I want to say to that, Sarah, is my team has authored now a definitive guideline based upon evidence-based research, real science into determining what amount our seniors, adults, teens, our school-age kids, and even all the way down to 1 year of age need to have on a daily basis to protect themselves so that we can have a safe return to in-person education, a responsible reopening of small businesses, and a getting back on with our lives. Because I don't know about you, Sarah, but for me, Americans don't let Americans die alone. But that's been happening. Americans don't let American children suffer alone. But that's been happening. Americans, at our core, we are good. We are good people. And what's going on right now is not good. So to that end, Sarah, I'll answer your final question about the asymptomatic transmission and build off of what Ms. Garner had said earlier about the Wuhan study. There was one study done about asymptomatic transmission. This is going to blow your mind if you're watching this at home. It blew my mind. It was published in November in Nature Journal. The Wuhan participant study had 9,898,828 enrolled participants, almost 10 million participants that they tested using the PCR. Only 300 possible asymptomatic carrier candidates were identified. So then they took those 300, they said, let's get confirmatory lab tests. They're doing what should happen. Of the 300 possible asymptomatic carriers, all were tested using live cell culture to determine if their PCR samples could produce replication-competent virus, a phrase you've heard Dr. Fauci say repeatedly. All 300 of those people that they thought were asymptomatic carriers, not one of them could produce a live cell culture, meaning that none of them were infectious. So what that told us was that out of the 9,898,828 people tested in the largest study ever conducted in a single year with enrolled participants, there was a 0.00000% chance of asymptomatic transmission. It has to this day never been proven. Our fifth paper proves that, and all of these studies that you see coming out, funded by the NIH, funded by the CDC, that are published in JAMA, they are nothing more than projection model studies with 0 enrolled participants. They are, in essence, scientific fraud. And it's something that is absolutely disgusting and that we have to denounce as a culture so that we can get to the heart of the matter and get on with ending the suffering that our brothers and sisters are going through right now. I cannot abide by the amount of suffering that the people that we love so much are enduring. It's been too long. It's enough. Let's get on with it.
That is so beautiful and so resonant, and I really appreciate that you communicated that to everyone listening.